Sorry, 1 second here. And for those that are the audience members that are in, thank you guys. We're going to get started in 1 minute. We'll get going. Going. All right. Thank you, everybody, for joining us. This is part of ADC's ongoing webinar series during this COVID crisis, as we're trying to provide as much information as we can to the community on different topics and different issues that are impacting us all directly. And we're hoping that everybody's staying inside, staying safe, and out of harm's way. We're fortunate enough today to be joined by two amazing speakers who have a lot of experience. And I'll get things going by introducing our ADC National Board member, Dr. Sahel Tubia, who has graciously offered to moderate this session. And we'll get things going with Dr. Sahel. So thank you, Dr. Sahel. And if you want to introduce our speaker and get things going. Thank you.
Thank you, Abed, and thank you for the introduction. And more importantly, thank you for presenting this opportunity for our community to be able to be more informed about the situation we're going in at this point. I'm sure everybody's watching the news. Everybody's watching, glued to the news because of the situation. So we were fortunate, and I have the pleasure to be introducing Dr. Gigi El-Bayoumi. I'm very impressed with Dr. El-Bayoumi for many reasons. Number one, she's the product of George Washington University School of Medicine. Then she ran the program for internal medicine for 15 years until 2013. To give you a quick idea what being the residency program director at George Washington University School of Medicine, by watching the news over the last month and a half, you see a lot of pulmonologists, specialists in lungs, because that's where the problem with the coronavirus mainly is. And then you've seen a lot of cardiologists, you've seen a lot of internal medicine, infectious disease specialists. All of those specialties had to have a residency program in internal medicine. And probably Dr. El-Bayoumi will mention to us some of the people that trained under her in the program in internal medicine probably became some of the people that you're seeing every day on the news and on TV. And that's a very important role, because once you prepare doctors to be excellent general internists, then they'll become really real power in the community. Dr. El-Bayoumi moved on for the past 7-8 years to focus on the Rodham Institute for Health Equity, and she will have the opportunity, and we'll have the opportunity to ask her some questions about this. As you know, the world has been devastated by the recent coronavirus pandemic, starting in China, going through Italy, most of Europe, then in the US. The virus continues on spreading worldwide, more so in the US. Our understanding of the virus is on the move. What we understood 4 weeks ago is very different from what we are understanding now. We could spend hours on this topic, but we are limited on time. So let me start by asking you, Dr. El-Bayoumi, about, in general, the ideas about data regarding this pandemic. And I would start with the first one. What are the most common way of contagion and prevention, and what are the most common and uncommon symptoms of coronavirus?
Sure. Well, good evening, everybody, and ahlan. I am delighted to be with you. I'm sorry it's under these circumstances, given what we are going through in the world. And Dr. Suhail, thank you for your gracious introduction. I'm going to make one small correction. I'm actually a University of Michigan product. I went to undergrad and medical school and then did my residency there. I'm going to start off by kind of giving the disclaimer, in the sense that first of all, I'm a practicing clinician. I'm seeing a lot of people. I just actually had one of my first patients die of COVID-19. But I want to just say that the information that I will give you today is the best information that we have available now. This is evidence-based, this is based on research, and what I say today may change tomorrow, because this is a novel virus, meaning new, and it's changing, and we're obviously getting a lot of information and rapidly learning, unfortunately. So the virus is a virus from a family of viruses, coronavirus. that's the family. COVID-19 is a specific virus that was discovered in 2019, which is highly contagious. In other words, if I had a teaspoon of the virus, that is what's basically causing the entire infection. Very, very tiny particle. It's complicated because if it doesn't have a host, a living host, it actually is not living, which is kind of strange. But the way that we contract the virus is the way that we contract the cold or the flu. We inhale it, it goes into our nose and into our upper respiratory tract. And then when we cough it back up and somebody else goes around and basically inhales that, that's one way. The other way is that the virus can actually live on surfaces, right? So that's why everybody has been using the different disinfectants. And we can talk about that later, which are the best ones to use. So that's another thing. They can actually also live on your clothes. I think the most important thing, I don't like to call it social distancing, I like to call it physical distancing, because we, especially as Arabs, I mean, the social aspect is so important to us. It's actually been very hard for me personally not to hug people, it's very hard. So it's really the physical distancing which is important, at least 6 feet. So if you want to just sort of an arm's length, that's one. That's prevention, prevention, prevention. The masks that we wear, of course, the type of mask that I wear in the clinic when I was seeing patients today, or in the hospital when I'm working in the hospital, is very different than the masks that the public uses. Because a lot of masks, are not available in the stores. You can actually make your own mask. My nephew was using a hatta. I said, Ziad, be careful there. Maybe you want to use a bandana or something. But what people also forget about is gloves. So one of the places where you can get sick is the grocery store, because you're going in, people have been touching, you look at items on the shelf. If you pick it up, look at it, read the label, and then put it back, that's actually a place where you can contract the virus. So I tell people, go with your list, look at the shelves, decide what you're going to take, and then take it down. So gloves are important, and they can be your winter gloves. Doesn't need to be fancy. We actually are learning that the virus is also excreted in the stool. Now, that's not such a big deal for adults, but it may be an issue for kids, right? If you're changing diapers or, these kinds of things. But so children are really a reservoir, just like they are in normal times. They may, get the sniffles and then they kind of feel better, but they actually can infect the adults. So washing hands and washing hands for 20 seconds. This means singing whatever song you like, whether it's row, row, row your boat twice, or let's say happy birthday twice, or some other Arabic song, I don't know. And then when you're washing your hands, you really want to wash between the digits. You also want to wash the back of the hands. You want to also get the forearms too. And you want to use relatively hot water. I just came from outside. I also washed my face. I think sometimes people forget about the face as an exposed area. So I know that's a little bit of a long answer, Dr. Sohail, but those are sort of the main things in terms of prevention.
No, absolutely. That was very good to give a general idea about some of the details that we might miss. And for example, like you said, in the store, grabbing some merchandises, fruit, vegetables, when you bring them home, you want to wash them and be careful about that. When we first started hearing about the coronavirus, it was statistically that the majority of the people who were hit by the virus were older people in their 70s, their 80s, and their 90s in nursing homes, and people with underlying conditions. Is this still true now or not?
So good question. And as I said at the very beginning, our data and our information is changing. So what we have found is that basically everybody can get infected. The real question is, where are the deaths? So as I mentioned, children, they have very mild symptoms, if any at all. One of our colleagues who's a pediatrician who works at Children's National said, you know what, they may just get the sniffles, a cough, maybe a fever for one day, and they're fine. So it's hard to really know without testing, mass testing, who is actually gotten infected. But for purposes of this webinar, I think it's important to know who is at risk for death, because of course, those are the stories that we hear. We know that, thank God, in children, only 1.7% of all the deaths have happened in children. And even in those kids, there are kids who may have congenital heart disease, cystic fibrosis, some of these pretty dramatic chronic diseases. So thankfully, children are not significantly impacted. In addition, pregnant women, and I'm about to be a great auntie again for the second time, and my niece is going to deliver next month. Thankfully, pregnant women don't seem to be impacted. There are some other viruses where pregnant women can get into real trouble. So far, we have not seen that. The group that we are seeing, let's just start off with sort of young people and maybe into middle age. Young people, the reason why they get so sick is they have what we call just an exuberant anti-inflammatory response. So if we have a foreign invader, a bacteria, a virus, our body, of course, has to defend itself. Otherwise, if it doesn't, we could die of an infection. So with young people, it's not only the infection, it's also the response to the infection. So what happens is that like a whole army of cells, inflammatory cells, floods the system and floods the lungs, so much so that oxygen actually can't exchange across the membrane. And so that's why younger people can't breathe. Now, what's different about younger people, and thank God they don't have a higher death rate as older people do, is because they're young, their reserve is much greater. So it's unusual for young people to have underlying lung disease, heart disease. This will give me a chance to say no shisha, no hookah, because actually that can impact your lungs and your ability to fight this COVID virus. Now, other things that we're seeing in young people that we were not so aware of at the beginning is that about 20% of people who are hospitalized, and this is what I want to make the distinction, people who, a lot of people get sick, 80%, we handle them as an outpatient. I'm taking care of a lot of people at home. They never have to leave the house. We can handle their symptoms. That other group of about maybe 20% are overly represented by older people and people with chronic disease. So something like 80% of the deaths are happening in people 80 and above. These numbers are fluid, they will change. And actually recently, as some of the nursing home deaths have been counted, we're seeing these numbers actually skew up, right? Because it turns out that people actually had COVID and died from COVID a lot earlier than we recognize. So what do older people die of? Well, they are probably more likely to have things like diabetes, to have lung disease, heart disease. So their overall state of health before they get sick is very important. And older people just don't have the reserve that younger people do. The interesting thing about younger people, and especially for your audience, I really want to stress this. Younger people, when they're sick with this virus, can kind of go along and feel good, and yet their oxygen content can be super low. And we see this in other illnesses with young people. They're going along, and then they fall off the cliff. So what I've suggested is that people buy pulse oximeters. I have a pulse ox at home. You basically can check your oxygen at home. We should be above 90%. If you start to fall into the 80s and certainly 70s, that's when it's time to seek medical attention. So that's the difference between younger people. Older people will present much more with shortness of breath. This is when they go into the hospital. And I would be happy to, make sure that we talk about the overall symptoms, but the deaths are happening in older people. One of the theories about Italy and why there were so many deaths is that the area, the population was also older. And if you remember, over the last several months or years, there have been advertisements you can buy a house for $1. That's because the population is getting older and there are no young people. And so that tells you something about that population.
Okay, next question is, How about the geographic location? Does that have any effect on the spread of the disease, the proliferation of the disease, cold weather versus warm weather? We're seeing Africa having less infection than colder states. Is that true or not?
You know, we just don't know. I mean, there may be other reasons for Africa to have less, but we know that populations which have high density, and of course, Africa, Egypt, for example, is about 100 million. So we would have expected to see more dense populations. When it's colder, just like with influenza season, we tend to be indoors more and we tend to congregate more. Where when it's warmer, we tend to be outside. And of course, the airflow is higher when we're outside. So I don't know. Nobody knows that answer. But one of the theories, and this is just a theory, of why Africa and some of the other developing countries may not have as much in the way of deaths from COVID is because in Africa, BCG, which is a vaccine that everybody's required to have that has some protection against tuberculosis, is a vaccine which seems to boost the immune system. So it may have some benefit of coronavirus, but this is all speculation. I mean, we need a lot more research, a lot more science. These are important questions. We just don't know. But when we're talking about perhaps a second peak in the winter, I don't know if it's because of the weather per se, or whether it's because we go back indoors and we're around each other more.
Okay, my next question is the number of infection and death in the US versus the rest of the world, like China, Italy, Spain, Germany, South Korea. Why is there more progress and more pronounced number of death and infection in the US, though we've had the most warning among all these the countries that I listed to be prepared for the storm? And nevertheless, and I'm not trying to ask any political question in here.
I understand.
It's mainly from a medical point of view.
Sure.
Why do you think that we are lagging behind? We're going to be almost 50% of the number of deaths in the world.
Yeah.
We're going to be about 50% of the number of infection in the world, and we
Yes.
are very technologically advanced.
Right.
So what do you think caused that?
Well, I think it's important for us to just give some basic statistics about our health system, because this might surprise some audience members, but when we are looking at our ranking and overall health in the world, we are number 37. So you know how we're always saying we're number one, we're number one? Well, sadly, we're number one in coronavirus and deaths from coronavirus. But before this disaster hit, we were number 37th in the world. So we're a country sort of two extremes. We have this amazing technology, which can save people and, you know, prolong people's lives, and, you know, cancer medications, you know, these wonderful devices that can save people from heart disease and so forth. But then on the other hand, the very basic things, whether it's a public health structure or whether it's the things that keep us in good health, are just lacking. So let me give you an example. We think of ourselves as physicians as really being the ones that really are responsible for people's overall health. But if you look at a concept called the social determinants of health, it turns out that what we do for patients only accounts for about 20% towards their overall life expectancy. The other 80% has to do with where you're born, what level of education that you have, what water you drink, what air you breathe, what food you eat, what is the neighborhood that you're living? Is it an economically well-off neighborhood? So I'll give you this specific example of Washington, D.C. We're a city of about less than a million people, okay? There are lots of people that come from Virginia, lots of people that come from Maryland, so our numbers go up in the day and then they go down in the evening. So the city is just 10 miles and we have what we call 8 wards. So if you live in Georgetown, maybe some people are familiar, it's a fancy part of town, you know, all the shops and so forth, very beautiful part. Your average life expectancy is 94 years. If you live in the poor section, which is in Ward 8, your life expectancy is 66 years. So it's a big, big disparity. We actually have the largest disparity in the country, and the United States has the largest disparity between rich and poor in the world. So that's number one. Number two, if you look, for example, at people's baseline health status, there are a lot of people who have, I mean, think about it. We don't have universal insurance, even for the ones that do. Many people don't accept Medicaid or Medicare. And if you're trying to choose, let's say you're on a fixed income because you're older, trying to choose between whether you're going to get the medications or eat, well, we know what choice people are going to make. I'll give you finally another answer. And that is, do you know how many people go bankrupt in the United States from healthcare costs? It's $650,000 a year. All of the countries that you mentioned, 650,000 people a year. All of the countries that you've mentioned, it's zero. Nobody gets bankrupt because of healthcare costs. So and then let me speak about the public health system. Taiwan, right next door to China, we would have expected that the numbers would be up. But what did they do? They had a pandemic unit in place. They had learned from SARS, if you remember, which was even more deadly actually than COVID. But what they did is they noticed that this was a problem. They went immediately to China and said, what's going on? Now, the Chinese government was not necessarily so forthcoming, but what they did is they noticed and paid attention to the people that were coming back from China. And then when they came back, they said, okay, we're going to quarantine you and we're going to trace all of your contacts. So if you went to the grocery store and talked to, I don't know, Muhammad, and went to, wherever, I guess it wouldn't be Muhammad, but wherever, they trace it. So they were actually able to contain it because of these basic public health measures. For Germany, which I would say is pretty similar to the United States in terms of technology, they had the coupling of an excellent public health service. They also have a healthcare system that had the capacity, both in ICU beds and in just in overall, and their death rate is 0.78%. So I think it behooves us to do, and forgive me for using this term, a post-mortem analysis after this is all over to figure out not only why we did badly, but more importantly, what can we do so that this never happens again?
I totally agree with you, and I think this is unfortunate, and which brings me to the next question. When you're thinking about this past 6 weeks we went through, where do you think we're heading? And what brings a smile to your face when you think about the future? And what really gives you anxiety and nightmare thinking about what could happen?
Yeah, for us in Washington, D.C., we're actually seeing the ramping up. So, I'm glad that New York, which is really hit very, very hard for a variety of reasons, the international travel, the density, et cetera. We've learned from New York, so we've tried to put on all those measures of, really shutting the city down and self-quarantining and staying at home. But we are seeing the numbers go up nevertheless. It's projected that here in DC, we're going to hit our peak by, May 15th. But this is a very dynamic number. Why? Because, for example, when you have states that are opening up their beaches and tattoos, salons, et cetera, it's likely that we're going to see the numbers go up. And so even if you're doing better in one area and another area goes up, we're all interconnected. People are not just staying in one place. I think that, we've seen, and anybody that follows that Johns Hopkins map, which I think is amazing, where you can get all the statistics, you have seen the United States start off as being very, very red in New York. And then you saw this wave come over the entire country. But the wave is not one wave, it's multiple waves, right? And so it's rolling waves. When you ask me what brings a smile to my, thanks for putting that up. That's terrific. Here it is. So you can see, you can bring up, you can make the map larger for the United States. And you can see what Dr. Suhail was actually mentioning about Africa being relatively less red. But you see what's happening here in the United States. You see how initially, if you have looked back, initially it was just like really the East Coast, some in the West Coast. But now you're seeing all these other places in the middle light up. And you have to remember that these are places which may not have a lot of population, right? I mean, in Montana and some of these other places, there's not that many people. So even these dots can be a little, sort of underestimate just how bad it is. So the numbers that we really should be looking at are per capita, for 100,000 people, what are the rates? That's actually more meaningful information. I look up Egypt every day because my parents, who were supposed to be here, they spend about 4 months a year, are there. And because they're in a lockdown because of the military rule, they've actually been in lockdown for 2 months. And so even though, people say, well, the accuracy of the numbers and so forth, and that may be true, but also we haven't heard about a lot of deaths that have been happening. I think they're at like 300. So when you ask me what puts a smile on my face, I think that this whole COVID-19 has kind of put a reset button on our society as a whole, on our planet as a whole. I think that, for those people that were kind of running and not thinking about sort of the meaning of life, who is important in their life, what's really important, forgive me, I'm of a particular generation where I'm not really impressed by people posting what meal they ate, no offense to anybody who does that. But it's like all of a sudden, I'm somebody that loves to look at like celebrities, People magazine and so forth. That's like my guilty pleasure. All of a sudden, I can't even look at that stuff anymore because it's like it's so trivial and it's so self-indulgent. So the thing that brings a smile to my face is that we are collectively kind of going through an introspection, not just individually or as families, but I think as a society to say, really, who are we? And how we deal with this problem, I think, is a real reflection. I am really impressed by my colleagues and all the frontline people, whether it's, staff or people that are doing meal delivery or bus drivers, etc. Not to mention, of course, the physicians and the nurses, because God bless them, the nurses actually, except for the doctors who are doing the intubation, putting people on the respirators, the nurses actually have very, very high exposure. And so that's what gives me a smile to my face. That's what makes me so proud to be in this profession. It reminds me of when I was, starting off my internship, which is that was the beginning of the AIDS epidemic. And at that time, it was 100% lethal within a year. And of course, because it affected a different group of people, and people weren't as, at that time, to be gay, there was a lot of stigma. And so people were like, well, it's just this community. The difference this time is that really, essentially, anybody can be impacted. The things that kind of, make me stay awake at night and to worry are that as this goes on, that there's a kind of complacency that develops. One of the things that's really bothered me in the media is the discussion of economic versus health, which I think is just a false comparison. Both are important. I mean, especially for poor people. I mean, it's like, are you kidding? The economy is vital, and so is people's health. But you know what gets lost in the discussion to me? And that's humanity. Where is our humanity? Where is our morality? Because at the end of the day, we all are born and we all die. And to me, what's most important, as I'm sure almost everybody that's listening in, is our name and our integrity. To be able to say that we were decent, we had integrity, we were credible, we were good human beings, right? And certainly in the various faith traditions, this is true. And so when I see how some people are being treated differently, whether it's the elderly, people from Black and Brown communities, and who we haven't even talked about are the disabled, right? the people who may be blind or deaf, or people who are undocumented. Imagine people have been scared stiff with immigration. Now, if they're undocumented, people who are in prison, people who are homeless, people who are LGBTQ. So all of these people, and of course the elderly, which in this society, people are really isolated. I talked to you about the social determinants of health. I live in one of the wealthiest sections of Washington, D.C. 10% of people who live here and the elderly don't have enough food. These are wealthy people, but they don't have enough food. So these are the kinds of things that sort of worry me. On a personal level, let me tell you, one of my longtime patients died yesterday morning. I've been taking care of him for 30 years. He was a father, a grandfather, a son. He was one of 11 people. He was a police officer, very proud. And his mother outlived him. She was 83. She is 83. And he died by himself. And that to me is heartbreaking, heartbreaking. I mean, death is difficult. And I think for all of us, we would want to be surrounded by our loved ones. And, when I sent him to the emergency department, he was crying, weeping, and it's not often that you see men crying that way. He was so scared, and he knew from the outset that he was going to die. So that kind of loneliness, as a clinician, as a healer, as a human being, that I have to tell you, I shed a lot of tears for him. And of course, as a physician, my role doesn't end with his death. I'm taking care of his family, who are, as you can imagine, completely devastated.
I'm going to move to another topic now, and the topic will be about testing, treatment. But let me start first with the myth versus truth. We've heard a lot of things. You mentioned one of them, BCG, which is the vaccination for tuberculosis, and some all over the world, but mainly in Africa, and why this could be helping in Africa. Mm-hmm. We've heard about the hydroxychloroquine, Zithromax. We've heard about vitamin C, iron, and could you briefly comment on this?
Sure. One thing I feel like I didn't comment, I think you asked about it and I just didn't answer, were the symptoms. So let's just start with some basic symptoms. So people, there are of course people who have no symptoms. We've talked about children. And then people who have these symptoms, they will describe a headache. They'll describe very high fevers that can continue for weeks, body aches, cough, shortness of breath, chest pain, abdominal pain, and diarrhea. And actually the gastroenterologic symptoms, we at first said, no, that can't be COVID. It turns out it's in about 50%. So the testing has been challenging because when you have a new virus, you don't have any tests, right? So there was a race to really try to figure out a test that was accurate, right? Because you don't want to miss people who have it. And the initial tests, 30% of people who had it actually tested negative. You also don't want to test people and have them be false positives when they actually don't have the disease. We've made a lot of progress over the last several weeks. For example, at GW, we have a test where within 4 hours we can get the results. And actually there's a newly created test where you can get, if you're positive, you'll get the results back in a minute. If you're negative, it'll take 15 minutes. I think the collection of the samples is what's really uncomfortable. They really have to put in a nasal swab very, very deep in the back of your nose. And then there are issues around the ingredients that allow us to do a test. And I liken this to, because I hear people say reagents. Well, what are reagents? So when you're baking a cake, you have to have flour, eggs, you've got to have the basic ingredients. So if we're going to do testing and we don't have the flour or the chemicals or the tubes or whatever else that are needed, right? Even the collection, the swabs that do the collection, that means that we don't have a test. So there could be many, many parts of that process that if we're having shortages, it means that we don't have adequate tests. But we're beginning to see a ramping up of tests. So I think that for testing, if you have the virus or not in real time, there's some progress there. In terms of the antibody tests, so the virus is very, tricky and smart, even though it's not living, which is kind of an interesting, I guess, philosophical question. But at any rate, it seems to be behaving like hepatitis viruses, where it's not just, like if you have an infection, you fight the infection and then you develop an antibody and that's it. But with hepatitis, you can see 3 different sort of peaks of the virus, of an antibody to a particular part of the virus, but you still may be infectious, and then another test. And then there are people who can remain infectious even though their acute symptoms may have gone away. So there's a technical challenge of an antibody test. And unfortunately, right now, so far, and I hope that this changes, they're really not very helpful. I think that their accuracy is maybe in the 60 to 70% range. Again, you don't want to be told that you're fine and you've got the antibody when you don't, or vice versa, right? Because this has implications for being able to go back to work, to be able to go back to school, to really reopen the country. It's a technically very complex problem to solve, but there are many brilliant minds all over the world that are really racing to do this. And probably what you'll find is that you'll find, just like with the testing for, whether you have the virus or not, you'll probably find that there will be multiple tests. I'm not sure about what the time frame is. In terms of your third question about treatment, unfortunately, some of the people pressing and endorsing hydroxychloroquine has actually caused some deaths, because when we're in a desperate situation, people desperately want to try things, right? And as I said, I took care of people with AIDS, and I was the only one pronouncing them dead. Nobody wanted to go in their room. Nobody wanted to give them food. It was horrible, right? Our hospital, which is now 300 beds, was 600 beds at the time. And I don't know if anybody in the audience has watched the Texas Buyers Club with Matthew McConaughey. He was actually getting medications which were actually accelerating people's death. It turned out that after a study, and this is why science is so important, it's not just important to say, well, I took the medicine, I got better. That doesn't necessarily mean that it was the medicine that got you better. Maybe you were going to get better anyway, right? So sadly, because we all want these medicines to work, right? Nobody's rooting against them. But sadly, with hydroxychloroquine, there were actually increased deaths. So they actually stopped the trials, the clinical trials early. Azithromycin, same thing. There are other treatments that are being looked at, the Ebola virus medication. But again, it's got a ton of side effects and it's not FDA approved. However, we in medicine have this notion called compassionate use. So if you've tried everything and you think that maybe this will work, you basically petition the FDA and get compassionate use. You asked some good questions about vitamins. I think those are important because there's a lot that's going around about that. Again, it has to do with what your baseline status is, right? If you're not somebody that's eating a nutritious diet, of course, taking vitamin C, zinc is something, vitamin D even has been looked at. Iron, the idea behind iron is that iron actually kills bacteria, but then it lets other bacteria thrive actually, when it's in your system. So some people with iron storage diseases actually are very prone to some deadly infections. But again, this is something that I looked at as recently as a few days. We just don't know. People are saying, well, it worked in my, cousin, or it worked here, and this is what they gave them. We don't have a good body of evidence. I will tell you what does work. Sleep and lack of sleep is tied to a reduction in immunity. If you will, one of the good things about this, not good things, but a silver lining, is that I hope that people are getting more sleep. Now, there's a subgroup which is getting less because they're very, very anxious, but sleep is very important. That's when the brain basically clears all the toxins, and people may not realize that, but if you're sleeping, that actually, if lack of sleep can increase dementia. So you have to sleep. Eating color, okay, what does that mean? It means fruits and vegetables, and I'll tell you the fruits and vegetables that work the best in terms of immunity. Avocados, mangoes. Turns out that dandelion root, which you can make as a tea, can help to sort of boost your immunity. So all the green, the red, the yellow in as much as you can. Now, it may be an issue that you can't get produce for a variety of reasons. Frozen is the next best thing. Canned is sort of the third thing because frozen really retains most of the vitamins and minerals. So, but there are some groups that are more likely to have vitamin deficiencies. So for example, if you're taking metformin for diabetes, those people tend to be vitamin B12 deficient because the medicine prevents you from absorbing that. If you're a vegan or don't really eat a lot of red meat, vitamin B12. So I wish I could answer your questions sort of more specifically about iron and all these things. Many of these, especially what we call the water-soluble vitamins, I don't think that there's harm, like B and C. But remember I don't know what you learned in medical school, Dr. Sohail, but the fat-soluble vitamins, and I remembered it by saying vodka, where vitamin A, D, E, and K, those are the fat-soluble ones, and actually you can kind of overdose from them. So we've got to use common sense. I go to the CDC website. I go to trusted websites, medical websites, that is, to get the information. And stay tuned. This is ever changing.
We've noticed that the state of California, which is the most populous state in the country of 40 million, has basically the lowest number of infection and death compared to other states like New York, like Virginia, like Mississippi, like Michigan. Do you think the early jump on locking people at home, asking them to not go to work, and the physical distancing played a big role in that discrepancy between the California and the other states?
Yeah, I mean, look, the state of Washington actually was really instrumental in sounding the alarm. The state of Washington during normal times does influenza surveillance. So they knew that something was up. And so they helped to sound the alarm. And I think that, I almost think that the western part of the United States is like a completely different country because they have systems in place. And, they believe in the science, right? And when you believe in the science and you believe in public health and you have a holistic approach to health, then they put in measures that work. So yes, I believe so. I mean, I think we need to study this more, but, those countries and those states that have done the physical distancing, have taken this seriously from the outset, they're reaping that benefit. Some of the audience members may have been reading about the influenza epidemic that happened here in 1918, and there's a very good example where they compared St. Louis versus Philadelphia. And St. Louis took the quarantining measures very seriously. Philadelphia, I think they had parades, and then you can just see the differences in numbers. So this is not a new problem, but we have to, sometimes I think as our society, quote unquote, advances, I think we go back, go backwards. We forget just the basics, and the basics, whether it's hygiene, whether it's, how we eat, or common sense, certainly science and working together. I think, I hope that this is one of my hopes, that as a result of this crisis that we're collectively going through, that we can learn from this.
Thank you. I see that we've been 45 minutes into this webinar, which is very interesting and important for everybody. And as I said earlier, we could spend hours discussing this. I don't mean to take a lot of your time. I know you're quite
My
busy.
pleasure.
So I have few more questions to continue, and then probably I understand there are some questions from the audience. Going forward, where do you see normal life? Are we going to have a normal life again? When? When do you think? And how is this going to affect the relationship at work, at home? And what are the factors that we need to see happening to really restore our normal life? And finally, and the other one is, do you see any second wave of coronavirus happening this coming fall and winter?
Yeah, you're asking such important questions, and the majority of the answers I'm going to say I don't know, but I can give you my speculation. Based on the data, and actually Dr. Fauci is a colleague and a friend. Actually, he's a neighbor not very far from me, and he's somebody that I just have absolute respect and admiration for. So he's somebody that, obviously is very knowledgeable and has experience with AIDS and Ebola. So he is predicting a second wave in the winter. And again, that may be related to the fact that we're more indoors, right? In terms of returning to normal life, I think a couple of things need to happen. We need a vaccine. And right now, it looks like it's probably 18 months away, 12 to 18 months away. That was transformative for Ebola, for example, which was much deadlier. Returning to normal, I think our normal is going to be a new normal. And some of it is not necessarily bad. I think, when I've been walking around, trying to get some fresh air, I've never seen more people with their families and kids. It reminded me of my own childhood when people were playing outside. I think that people now recognize that telework or telemedicine is something doable, and perhaps that will give more of a work-life balance for people so that they're not, spending all the time commuting in the car. And it's like, oh, well, you know what, for some of my patients, they can check their blood pressure at home if they're able, and we can have the visit, if they need to have a physical, or something examined. We've been very creative with the Zoom about what we can see. So I think you're going to see a shift there. I think also a positive is that, especially in places like Los Angeles, you can probably answer and speak to this much better than I. The air has cleared. I mean, we were talking about reducing our carbon footprint. This is a pretty dramatic way of doing it. I think that, we are going to be going through a collective PTSD, post-traumatic stress disorder, and it's going to be different for different people. And it's going to be different depending on whether you've lost loved ones, whether you yourself have been hospitalized, whether you have really lost everything economically. Let's not forget kids. I mean, not being in school or not being able to celebrate a graduation, not being able to go to a wedding. These are big things. And we as a society, no matter where we are from, rituals are very important, and that's gone. The other thing I always like to tell people is that when we interact, even if we're interacting remotely, our collective or our individual dopamine that bathes our brain actually goes up. This is the feel-good hormone. So when isolation is present, those numbers are decreased. So I'm seeing a lot of anxiety, a lot of depression. So returning to normal is going to take some time. People use the example of 9/11. I mean, that's an example that obviously our community disproportionately was impacted by because of all the things that happened in terms of profiling, et cetera. But this is the entire globe, that we have gone through this. So I think what you're going to see is different stages of people. I think actually that some of us older people with a few more gray hairs may have a little bit of an easier time because of perspective, knowing that this too shall pass. I think it's been very difficult for our young people. Very, very difficult. I mean, I was young once. I'm sure you were too, Dr. Sohail. We love to go out. We love to, dance and have parties and so forth. And being in lockdown is really no joke. The perspective that I'm always trying to give my nieces and nephew is, think of it, we're lucky. We've got food on the table, a house over our heads. Think of all the people, especially from our part of the world, that are in war, that are in refugee camps, etc. We are very lucky. So perspective is very helpful. The other thing I think we're going to have to do is look at, for any of us that have gone through a difficult time, what was it that got us through that difficult time before? But it's going to take some time. I think we're going to really have to be open and honest and get mental health services. There's no shame in talking to a therapist, and now telehealth, you can actually get on the phone. It's a lot easier. I think there's been a recognition of the importance of that. So I think it's going to take time, but I also see this, as I mentioned at the beginning, this is a reset button. I think we can, if we learn the lessons, as I think Governor Cuomo has been saying, we will come out better.
Let's talk about the health equity in our country. And I know this is a very important subject to you, to me, to a lot of our audience. But we're seeing Black and Brown communities are being disproportionately hit with the virus. And why do you think that is happening? And what do you think can affect the future going forward to these societies learning what we are learning now from this tragedy that we're going through?
So the virus, this is just the latest example of how Black and Brown and other underserved communities, white poor people, et cetera, all the groups that I've mentioned before, have been impacted. So, for example, the HIV rate the cancer mortality, end-stage kidney disease rate in Washington, D.C. is the highest per capita. And in Ward 8, our HIV rate is the same as Namibia's. Our infant mortality rate is the same as El Salvador and Cambodia. So where people are starting in terms of their baseline, their baseline health status is like in the basement. So if you're starting there and you're hit, with an illness, maybe an analogy might be if you look at where people live in the poor parts of an island, and there's a hurricane or a landslide or something. It's those people because they are on the margins, right? So if you're starting down, right, in our city, for example, we have one grocery store that serves 80,000 people. In our city, we have no place for women. It's a population of about 180,000, but the women of that community have no place where they can give birth because the labor and delivery places are closed. In our city, and this is before COVID, in our city, in our safety net hospital, which is in Southeast, the staff, not the patients, have nothing to eat after 3 p.m., Monday through Friday, and nothing on the weekend. So that's normal times. So can you imagine if those are normal times and then you have this? So that inequity, and again, we have some of the highest inequities in the world is why. I believe also that our public health system has really been, defunded in very big ways. I think that our educational system has been defunded. Do you know that the kids in Ward 8, only 42% of them graduate from high school. If I did nothing else as a doctor but got them to graduate, I would add 10 years of life to them. So I think what this, illness crisis has done, it's actually lifted the veil and uncovered a very well-kept secret about how bad our outcomes have been. So when you hear people talk from the Black and Brown and other disenfranchised communities, they're like, so what's new? This is just the latest. So there's an expression, that is in the African American community, when white people get a cold, Black people get the flu. So everything is disproportionate, and it has to do with those social determinants of health. So what can we do? Which is the whole idea of why I established the Rodham Institute, because I was really tired of these statistics. What we can do is really focus on education to get kids graduating from high school. Food. Did you know that food is the single strongest social determinant of mental health? So when you see that poor person begging for money, don't give them money, buy them a meal. That's actually going to do much more for the severity of their mental health. And then I think it really becomes, again, this issue of looking at our interconnectedness. I mean, in all of the faith traditions, there is something about our responsibility towards our fellow human beings. So, and that's our happiness, by the way.
The final question that I have for you is, and to have our audience in this webinar is, how can you prepare your body to deal with the stress that we are going through? How you can avoid the virus, how you can fight the virus, and what's the importance of sleep, exercise, diet, and stress reduction?
So I think you've mentioned the essential cornerstones of good health in regular times that become especially important during this time. So we've spoken about sleep, and sleep is really just very, very important, which means no devices, before we go to sleep. Sometimes I'm guilty of that. No watching the news and getting agitated. My nephew who lives close by, and so we're seeing each other. That's the only family member that I'm seeing. We've been watching nature shows at night. I don't, because it's something that you have to get calmed down. Studies have shown that even if you can't go outside or can't look at the ocean, just looking at a picture of a body of water or looking at a forest is a way that will help you sleep and calm yourself down. So really looking at good sleep hygiene. Second thing is food. We've talked about the green, yellow, red foods, as much color as possible. What I'm seeing, which is a little bit of a distressing trend, is people are sort of self-soothing by drinking alcohol. I've seen a lot of people do that. And I would say, as tempted, because there are virtual happy hours, as tempting as that is, trying to keep alcohol intake for people who drink down to 1 drink a day for women and 2 drinks a day for men. Cancer rates go up when those numbers are exceeded. But more importantly, for the purposes of your question, that actually interferes with good quality sleep. You may feel sleepy after you have a drink, but it actually interferes. Let's talk about stress, because that is huge. I always joke that when you fall in love, your immunity improves, but when you break up, it decreases. We are under a tremendous stress and strain. So those things that we do in normal times, for me, it's music. I love music. I love comedies. I love to laugh. I'm Egyptian. It's redundant. Sense of humor, I think, is very important. And then having heart-to-heart talks with people that you love, especially, I would say, older people. I talk to my parents and it's like, oh, it's going to be okay. It's going to be okay. Malish. These things are important. And then, if you need to talk to somebody or even go on medications, there is no shame in that. And let me tell you why. The hormones, the neurohormones that bathe our brains with chronic stress, those hormones decrease. And so a lot of the medications that are now available, and when they decrease, you'll get anxious, you'll become depressed, you won't be able to sleep. So you get into this loop, which reduces your immunity, right? For people who have gone through trauma, especially people who've gone through war or any kind of trauma, this may feel like house arrest, right? It may feel like, I'm in this situation again. It's good to talk to a professional, whether that's a social worker, a psychologist, or a psychiatrist, a faith, somebody in your faith tradition, if that's what you feel comfortable with. But I think our threshold for starting medications should be low. And this doesn't mean that you're going to be on these medicines forever. I prescribe melatonin to help people sleep. It's not habit forming. It's safe. But, obviously check with your clinician. And I think that, you have to figure out what works for you. The other day we were doing some, coloring books. I found that relaxing. Certainly walking outside in DC, our curfew is after 8. So I take a walk. I think it's inhaling that fresh air, being outside. It's spring, it's beautiful, but those are some of the things that I think we can do.
Well, I want to thank you very much. That was, I learned quite a bit from you. And I'm sure our people participating in this webinar learned quite a bit also, despite the fact that we've been bombarded with a lot of information, but still always there is room to learn something new. That ends my part of the questions that I had for you. Now I want to ask Abed if our audience had some questions for you. Please go ahead, Abed.
Yes, thank you. Thank you, doctors. We have a few questions. I'll summarize them just so we don't take too much of your time. A couple questions came from our members in Georgia. Of course, Governor Kemp is set to reopen the state this Friday. Well, basically, your thoughts on the reopening. One of the questions came from a business owner. Should he feel safe reopening the businesses, or what considerations should he be making to make that determination on whether or not to reopen the restaurant, and how to, basically whether they abide by the governor's order and feel free to go out there, or do they continue staying at home?
Yeah, it's a very tough, for a business owner, this is the individual's livelihood, right? He or she is responsible for all the people that are working for them, his or her own family. So when I answer this question, I'm answering it with the respect and understanding that these are huge, huge issues. And sometimes people don't have the luxury, right, of, some people can afford to stay home or even close their businesses temporarily. Other people don't have that luxury. I happen to disagree with the opening in Georgia because they haven't hit their peak yet. Having said that, if you have a restaurant, perhaps what you could do, I know a lot of places are doing takeout, or having some, at the very least, if you've made that decision, and I would really consult your local public health department, Department of Health, to see what the numbers are like. Have you gone through the surge? Have you not? But certainly people should have their temperature checked before they come in. And I think I was on Amazon.com. I think you can get one of those forehead temperatures, which is what we get before we enter any of our clinic or hospital buildings. That would be one. You would have to really require that anybody that comes in is wearing a mask and gloves. You would have to do deep cleaning several times a day. With that, it's a very difficult question to answer. But as things become more liberal, actually, I'll tell you, I got this question because one of my patients is the president actually of the Kennedy Center. And she called me up and she said, what should we do? When we open, what should we do? And I said, well, I don't know when that will be, but let me tell you some guidelines. So we talked about all the things that we just said. We talked about people going to the bathroom. You have to even regulate how many people are in the bathroom, because you still have to practice the physical distancing. And you probably should not let certain people come, right? So the people that are vulnerable, the people that, the older people, right? Because maybe, you have it, God forbid, I shouldn't use you as an example. A young person getting an infection might feel pretty sick, but the likelihood, God forbid, of somebody dying who's younger is much lower. So maybe they can say, if you're over the age of X, if you've got these conditions, I know that goes sort of counter to sort of our freedoms and so forth, but it's complicated. And so, and I know that people want to socialize and all that, but in as much as you can, have distancing within the restaurant. But I would really check with the local health department just to get a sense of what the numbers are. And also, if they start to go up, that maybe you should consider closing. But it's a hard decision, very difficult. And I wish the person that asked the question very good luck. And inshallah, you'll get through this.
Inshallah. We just had a couple more questions. One of them was about the antiviral drug remdesivir. I'm not sure if I'm pronouncing that right and whether that's proper.
Yes.
Also tied into the conversation is the outlook on a vaccine, because of all the information that's out there from different folks claiming to have one. But what's the reality on the vaccine and on some of these drugs that seem promising.
Yeah, as you can imagine, everybody is trying to test the existing antivirals that are out there, whether for hepatitis or HIV. And this one was actually used, the one that you mentioned was used in Ebola. But these are highly toxic drugs. So now they're being used in a clinical trial so that people can be monitored very closely. Because, I mean, you can die from these drugs. And just as we spoke about before, the hydroxychloroquine not only didn't work, but actually caused death. So you don't want to give something that's going to cause somebody to die. That's number one. But I can tell you that a whole bunch of trials are being done to look at that. The vaccine, as I mentioned, probably 12 months to 18 months. I mean, if you think about it, we've been trying to, not we, but the medical community has been trying to create an AIDS vaccine for how long now? And, you know, we still don't have one. Viruses are very, very difficult to vaccinate. Think about the flu vaccine, right? We can take our best guess at which strains are going to be around, and then we have one. We're not that successful. This is a little bit different because, thank God, and I hope this stays this way. So far, it's one strain, but it's going to be a while. So when you hear about predictions about when things can kind of open up, you're hearing people even saying 2022, which is a very frightening thought in terms of things really going back to normal. You know, things like I see the Detroit Tigers, and in back of you the picture, and I'm a Michigan fan. I love the Tigers, but you know, when can we go back to, you know, a baseball game, right? When can we go and have our hafalet and our, you know, get-togethers and so forth? I mean, because to me that's the bottom line, right?
Right. Thank you. And the one final question, I don't know if you have an answer, but this has also been asked a couple times. The misinformation that's out there, what can be done to combat it? Why isn't the CDC or others putting more pressure on some of these health officials, or what bodies are out there to maybe stop this, you know, from a professional standpoint from happening?
Yes. It is very dismaying. I think you may be referring to people like Dr. Oz and Dr. Phil and Dr. Drew. You know, I mean, I could give you my opinion, but I won't spend a lot because that would be another couple of hours. You know, there was actually a study that was released today looking at Sean Hannity giving misinformation versus Tucker Carlson, so both Fox people. And they found that when Sean Hannity gave the information, they traced the number of COVID cases, the death rate actually increased. Obviously, we're going through a crisis, a political crisis right now in our country. We're highly polarized. But I would say to the audience members, look away. I mean, we don't have to have this diet. It's like junk food. At the beginning, you know, oh, okay, potato chips, whatever, but then you can't eat potato chips all the time. So this is junk food. As much as you can, try to look away. Don't feed yourself that because it's not healthy. Go to the websites that are trusted. Johns Hopkins has an outstanding website. The CDC has an outstanding website. Again, it's not going to be perfect because our information is changing, but use sort of common sense. I mean, if something sounds like it's too good to be true, it's probably that. It's not going to be good, or not good, but it's likely that it's not going to be as advertised, right? So just like the things that we see advertised on TV and we expect them to eliminate our wrinkles or to make us lose, I don't know how much weight, you know, in a day, you know, common sense. And the disinformation is dangerous. Disinformation kills people, you know. We have to be smart. We have to value our education. We have to value the people that have knowledge. And I should say, it's not just the physicians that have knowledge. It's everybody that has knowledge. We all have knowledge. We have different vantage points, but we all have knowledge and experience. So for people, you know, for dealing with this, we need to look to people in the healthcare field because that's the area of expertise. If we're talking about education, you wouldn't necessarily be listening to doctors. You would be looking at the educators. So, you know, I mean, that's to me the casualty of sort of the social media and kind of anything goes and all of this stuff. So I can tell you what my opinion is about how to rein that in, but for purposes, just for some pragmatic advice to the audience, look away because it's stressful and you can feel like you're on a roller coaster, this one, that one. Look to trusted sites, look to a physician or other healthcare professional who you trust. I'm biased, obviously, being in academic medicine, because we tend to, not always, be sort of evidence-based, but yeah. Well, that's a long answer, but
No, it's an important answer. Thank you. Thank you. That's it for the question and answers. I don't know if you have anything before we close off, Dr. Sahel or Dr. Abayomi.
I will just end by saying thank you for this. Thank you for the opportunity. Thank you to ADC. I think that this is, for example, a thing that I think this is a positive thing that's going to come out of this. We can start to do webinars in the future on a variety of topics, right? So thank you for allowing me to participate. Thank you to Dr. Sohaid for his very thoughtful questions. I hope that the audience found this helpful. People can go to the Rodham Institute. We've got a website on COVID that can connect you. We happen to have resources, but they're more to, local resources in Washington, D.C. And thank you, Abid. Thank you for arranging this. I really appreciate it. I hope that everybody stays safe and healthy. And inshallah, we will get through this together, all of us.
Thank you very much.
Thank you. Thank you both. And thank you for everybody for joining in. We're going to have a series of these webinars coming up. Make sure you're on our email list. Make sure you check out Dr. Abayomi's website, and we'll be sending out a recording of this and other resource information for all those that registered as well. We appreciate everybody, and thank you, and have a good night.
Thank
Bye.
you. Bye-bye.
Thank you. Thank you.
Thank you.